Evening. My name is Shelby Esselman. Thank you for your time as I present my evidence-based population health improvement plan titled Meeting Community Needs. According to the San Juan County Community Health Needs Assessment, having a specific source of ongoing care was identified as a disparity in the rural secondary service areas. In these areas, 30.6% of patients reported a source of care as compared to the county average of 62.3%, the national average of 69.9%, and the Healthy People 2030 benchmark of 84%. These secondary service areas encompass portions of the Navajo Nation and surrounding areas and represent healthcare disparities within the Indigenous American Indian community, which represent nearly 40% of the population, according to the U.S. Census Bureau. Patients perceive that barriers to this care are long wait times to see a provider, difficulty with transport, and limited availability of specialists within the service area. The data reported in this presentation is highly reliable as it was derived from the 2023 Community Health Needs Assessment from a stratified random sample survey, as well as data and benchmarks collected from Vital Statistics, the U.S. Census Bureau, Healthy People 2030, the Centers for Disease Control and Prevention, the U.S. Departments of Health and Human Services, and the 2023 PRC National Health Survey. This data is also supported by current evidence from the Agency for Healthcare Research and Quality, which demonstrates that ethnic and racial minorities continue to experience poorer outcomes due to persistent healthcare disparities. This has been attributed to poor communication, bias, and impaired health literacy. In addition, these groups are negatively affected by access to healthcare, decreased healthcare quality, ineffective treatment, decreased safety, delays in care, and a lack of preventative care. Considering the barriers identified, this population would benefit significantly from the use of telehealth or remote monitoring on a digital platform as a means to improve access to healthcare providers from the current rate of 30.6% to the Healthy People 2030 benchmark of 84%. When working with Indigenous populations, a two-eyed seeing approach fosters engagement by incorporating Indigenous knowledge and culturally significant practices with Western knowledge and technology. Specific improvement criteria include A, providing resources in the patient's primary language, B, including translators who are trained to translate medical terminology, and C, incorporating cultural, holistic treatment options. Regarding technologies, providing patients with online resources, patient-friendly search engines, online classes, and in-person digital navigation courses are also effective ways to promote digital literacy, assisting them in navigating digital resources and telehealth applications. A lack of health literacy is perceived as a barrier among Indigenous populations, but is necessary to facilitate effective communication and help patients understand health information. This may contribute to misunderstandings between Indigenous peoples and healthcare personnel who assume that a lack of health literacy is attributed to a lack of care or engagement. Health literacy enables patients to obtain, comprehend, process, and communicate healthcare information and to make well-informed healthcare decisions. To address this inequity, the two-eyed seeing approach can be applied to establish cultural priorities, potential barriers, and infrastructure needs. In rural care areas such as the Navajo Nation, the application of smartphones may present a modality for facilitating communication and sharing information. The utilization of smartphones within Indigenous communities in North America has already been shown to greatly improve communication speed and is the primary means of access to the Internet. The United Nations has declared Internet access to be a human right, yet the limitation of the application of this technology is that an existing digital infrastructure is needed. This must be accomplished in conjunction with tribal leaders to mitigate risks associated with access to care, improve access to providers and healthcare information, and mitigate adverse outcomes due to a lack of healthcare access. Many of the current social, socioeconomic, and health disparities with Indigenous peoples can be traced to the long-lasting effects of colonization, assimilation, and lack of access to residential schools and healthcare. To bridge this gap, initiatives must be community-driven and patient-centered. Relationships with community members must be built on mutual respect, understanding, reciprocity, and prioritization to sustain impact. This approach entails that patients are treated as partners in healthcare practice rather than care recipients. This empowers the patient and provider to make holistic and culturally relevant healthcare decisions that improve patient outcomes and are valued by the patient. When we're working with Indigenous populations, a two-eyed seeing approach fosters engagement by incorporating Indigenous knowledge and culturally significant practices with Western knowledge and technology. The Navajo Nation utilizes a group of trained community health representatives to partner with community outreach and patient empowerment, or COPE, to improve patient engagement, compliance, and outcomes, utilizing the previously mentioned improvement methodologies. When considering the use of digital infrastructure for communication, it is also important to assess digital literacy in preventing misinformation, breaches of privacy, and security. These are all important issues to consider in fostering sustainable engagement that is ethical, safe, and culturally relevant. In utilizing the two-eyed seeing approach, the sovereignty of data, in addition to self-governance and social justice, have been identified as priorities in many Indigenous communities. This is especially important for communities that have experienced social inequities or forms of discrimination. As previously discussed, it is also important to consider the interoperability of digital telehealth technologies with video interpretation services in order to maximize the relevance and value of the modality for the patient. Pairing telehealth visits with professional medical interpreters facilitates communication of complex medical concepts and terms and allows the patient to ask questions to obtain clarity. In addition to ensuring that technologies are culturally appropriate, it is important to address potential linguistic barriers to success. Fortunately, expansion in telehealth also represents another innovative modality in the form of video interpretation. Language discordance not only impairs communication, but directly contributes to low health literacy and negative outcomes. Negative outcomes can be attributed to inaccurate diagnoses, poor follow-up, a lack of treatment compliance, complications from medications, redundant diagnostic testing, and lengthened hospitalization. As an evidence-based practice, healthcare institutions must facilitate access to professional medical interpretation services in order to provide ethical and culturally relevant care. Before the advent of digital telehealth technology, interpretation services were limited due to time and a lack of variety of interpreters. The availability of video interpretation significantly improves the access to interpreters fluent in a broad range of languages. Pairing this technology with telehealth access to care providers not only facilitates patient engagement and health literacy, but the ethical principles of autonomy supported by equitable and informed decision-making. Thank you so much for your time today. I'm happy to answer any questions that you may have at this time.